Hello, welcome to 𝗛𝗲𝗊𝗶𝗶𝗃 podcast. Today's episode is about one of the hottest topics currently trending around obesity and weight loss. And for that, we've gathered our experts, the best of the best, to give us all the information about it. Doctors, thank you for joining us.
Thank you.
Thank you very much.
Please introduce yourself, doctor.
Thank you, Dr. Anfal. I'm Ali Aldibbiat. I'm a consultant endocrinologist at City Hospital, Mediclinic City Hospital here in Dubai, and also an adjunct associate professor at Mohammed bin Rashid Medical School. Also, I lead the weight reduction services at Dubai Mediclinic Services facility in Dubai.
Doctora?
Yes, thank you. So I'm Nisrine Ghazal. I'm an endocrinology specialist in Mediclinic Dubai Mall, 𝗪𝗲𝗄 and Creek branches. I'm also an adjunct lecturer in Mohammed bin Rashid University.
Thank you both for joining us today on this very important topic. As you know, there are so many information out there on social media platforms. And for that, we'd like to take your input. We'll break it down into pieces and start right from the top. So I'd like to start with you, Dr. Ali. What are the types of weight loss medications currently available in the market? And how do they work in helping with weight loss?
That's a very good question, and this is kind of the key where we have our consultation with our patients. There are mainly 4 classes of medications in Emirates for weight loss. The first one is a type of tablets that prevent absorption of fat in food. It's relatively gentle medication, and people may lose maybe 6, 7, 8 kilograms over 6 months of time, but they can cause side effects like diarrhea. There is a second class of medication that works only in appetite. Also, it's a tablet, and it suppresses appetite, and that is taken in a gradual dose. It may cause a bit of a bit of irritability, maybe a bit of nausea, and it's also gentle. People may lose 7, 8 kilograms over 6 months or so. There is a third and fourth class, the GLP-1 receptor agonist and GLP-1 GIP receptor agonist. It's a mouthful, but they work in a similar way. And the way they work is by suppressing appetite in the brain center of appetite. And also they cause the stomach capacity to become less. So when people eat food, they eat less. And also the emptying of the stomach becomes slow. So when people eat and feel full for a longer period of time. And the last important one is reduction of insulin resistance. And this is the important point that some of those medications are licensed in people with type 2 diabetes. It helps reduce the insulin resistance, but also that makes the energy expenditure more efficient. So when people do exercise, they get almost double the outcome of energy expenditure and energy burning. And you can see by getting less calories inside the system and burning more coming out of the system, the net outcome is weight loss, which is a gradual, gentle weight loss. These are, generally speaking, very safe treatments. And yes, there are side effects, and they are mainly through the GI system, like usually maybe a bit of nausea, maybe bloating, maybe change in bowel habits, diarrhea or constipation, but nothing serious. They are safe for the kidneys, safe for the liver, safe for the heart, safe for the central nervous system. And the way they work is a gradual way. It's not like an aggressive way of weight loss.
Amazing. That must be amazing news for a lot of people.
Absolutely. It's an amazing tool that we are using now in the clinic.
Dr. Nisrine, I know everybody's thinking, could I use this? Could I benefit from it? So what are the criteria that normally we medically look for before saying that an individual can use these weight loss injections for weight management programs?
Sure. So when a patient presents to the clinic for weight management, we do first rule out any reversible causes for the weight gain. So any underactive thyroid, any high cortisol in rare cases, any low testosterone in men, etc. Once we ruled out all those reversible causes, we start thinking about weight loss injections or medications. So if a person has a body mass index more than 30, they do qualify for weight loss injections. Body mass index is weight divided by height squared. It's not very accurate in all populations, such as athletes, elderly women, etc. So we treat those separately. But for the majority of our patients, a body mass index more than 30 qualifies them for weight loss injection. But also body mass index more than 27 with any weight-related complications, so prediabetes, diabetes, cholesterol, blood pressure, sleep apnea, etc. So why these cutoffs? Because we want to ensure that the benefit of these injections outweighs the risk. Any medications we prescribe should have benefits more than risk. And at these cutoffs, we prevent long-term complications such as cardiovascular problems and other chronic medication intake.
Dr. Ali, coming back to you. So are there specific weight loss medication options that are more suitable for specific people depending on their medical history or their lifestyles?
Yes, certainly. As I mentioned with the four classes, each one has a specific way of handling excess weight and obesity, and we tailor those to each patient's needs. I'll give the example. If someone eats fatty food like burgers, barbecues, pizzas, maybe the fat absorption inhibitors are suitable for them. People who snack a lot, like maybe some people have 2 meals a day, but in between them they take more than 2 meals worth of snacks. That, the appetite suppressants would work really good for them. And we get those with insulin resistance or even type 2 diabetes. Then the third and fourth class of medications, GLP-1, GIP, receptor agonists, work in a beautiful way because they suppress the appetite but also reduce insulin resistance and encourage the insulin, the energy expenditure that way. That's why we kind of tailor the treatment to each patient's needs, and not every patient is similar to others.
Amazing. That's why it's very important to actually visit your doctors and decide which medication is best. Thank you.
Thank you.
So, Dr. Nisrine, I know Dr. Ali touched upon it earlier, but I'd like to go into a bit more detail in this regard. So I wanted to know about the side effects of weight loss medications, and how do you monitor them for patients? How do you address their concerns about them?
First, we do not give any weight loss injection to a patient with a family history of a very rare type of thyroid cancer called medullary thyroid cancer. We prefer not to give those also for any patient with a history of pancreatitis or pancreatic inflammation, specifically if that was due to another weight loss injection. We are also very cautious in patients with diabetic eye, because patients with diabetic eye with a rapid change in their sugar level, it might get worse. There are no studies for patients who are immediately planning conception or who are pregnant or breastfeeding, so also we prefer not to give those for these patients. But for the side effects, we need to set the expectations. For the first few weeks on weight loss injections, as Dr. Ali said, patients might experience gastric side effects, so stomach side effects, some indigestions, constipation, diarrhea, nausea is very common, headaches, and fatigue. Also, few weeks down the road, they might complain of severe hair loss. This is associated with any rapid weight loss. But also, we need to warn them, because you asked me how should we follow them. We need to tell them anything unusual, you have to report back to us. So any severe upper stomach pain that is constant, radiating to the back, not subsiding, we need to stop the injectable until pancreatitis is ruled out. So it's very important to have these medications taken under supervision, of course.
So how safe would you say they are under doctor's supervision?
So under doctor's supervision, when the patient meets the criteria, they are safe. And again, I will repeat, the benefit outweighs the risk, and the potential benefit on the long run outweighs the risk. So yes, they are safe when indicated.
Dr. Ali, I know there must be a lot of misconceptions that you face in the clinic with regards to these medications. Could you address a few that are the most common? And I know some people may ask, for example, if I'm not facing these side effects, it means I'm not benefiting. How accurate is this?
It's a very important point. Thank you, Dr. Amthal, for mentioning it. Actually, not everyone gets side effects. Those side effects are reported in clinical trials, and some people do. And maybe, let's say, about 30% of people get side effects, but 70% of people don't. So if you don't get side effects, doesn't mean the treatment is not working, and you should follow the advice given to you by your doctor and follow up with them. Yes, some people the treatment may not work, but that's less than 5% of the cases. So if you don't have symptoms, doesn't mean you are not benefiting from the treatment. But we get lots of misconceptions, and these vary from like, this treatment will cause me thyroid cancer, or this treatment will make pancreas weak and I will develop diabetes, or when I stop the treatment, I will gain double the weight. And this is to some extent not true, and there is a mix between facts and some fiction there. For example, like Dr. Nisrine mentioned, if someone has this rare form of thyroid cancer, medullary thyroid carcinoma, we should not give the treatment to them. Certainly not, and even if it is in the family. But we as humans, we ail. We may get, the medullary thyroid carcinoma or pancreatitis with the treatment, without it. But from very robust clinical trials and also post-marketing surveillance, no signals of safety has been issued there. It's a treatment that rejuvenates the pancreas. And actually, in animal models, we see an increase in beta cell mass, which produces insulin. Obviously, we cannot do that in humans. It's not possible. But if something that is rejuvenating the pancreas, how would it cause diabetes? So this is a complete myth. With regard to the rebound of weight, certainly that's a possibility. Our genetics are the same. When we give the treatment, and by the way, we look at obesity as a chronic illness. It's not a lifestyle illness, it's a chronic illness. It's a complex kind of condition with lots of contributors to it. Maybe lifestyle is a contributor, but it's not the sole contributor. So if someone takes the medications and lose weight, once they stop the treatment, and if they give their body same circumstances that led with the weight gain in the first place, the weight will come back. That won't be a surprise, and I don't think that would be something to blame the medication for. I always give the example of a sponge in the clinic. If you have a sponge that has water in it, if we squeeze it, it becomes light. But if we put water back on it, we will not be surprised if it becomes heavy, is it?
Exactly.
Because, it's the same kind of, the structure of the sponge is to take that. And our bodies, if we have obesity, have kind of capacity to make weight. So these are some of the misconceptions that we face in clinic.
Thank you. These are very important for patients to know about. Thank you so much. So, Dr. Nisrine, if we wanted to go into the details of it, so how do these injections basically target these fat cells, and how do they impact metabolism and the appetite regulation?
Okay, so actually these injections, first, they work on the brain part that is responsible for appetite. So they do decrease appetite, so patient feels less hungry, but also has less cravings. But that's not all. They also slow down gastric emptying, so the digestion is slower. So they will feel full most of the time. So they're less hungry, less craving, and feeling full most of the time. But also, this is not the whole story. As Dr. Ali mentioned, they work on insulin. So they do increase the insulin secretion from the pancreas, and that will keep the sugar steady. But they also work on the insulin sensitivity. So they increase the insulin sensitivity in what we call peripheral cells, so fat cells, muscles, liver as well. And the more insulin sensitive these tissues are, the more fat is degraded and the faster our metabolism is. So this is how they improve the metabolism and decrease the appetite.
Coming to the metabolism part, so is there a chance people might think that their sugar may drop too low because of benefiting so much from this medication?
These medications have not been reported to cause significant hypoglycemia or a sugar that is low enough to cause symptoms or potential side effects. So whenever the sugar is below a certain limit, these medications stop lowering the sugar further. So this is why they are safe for diabetics and non-diabetics.
Dr. Ali, from your experience, how much weight loss can patients normally expect, and how much does this vary between individuals?
There is a huge variation between people for several reasons, and I always give my patients the range. You may lose between 2 and 8 kilos a month, and the range is wide because not everyone would respond in the same way to the medication. Not everyone can put the same effort in exercise. We have busy lives, we have commitments, and so on and so forth. Some people do lots of exercise, and those people lose more. And some people cannot do exercise, like if they have injury, or they are bound to their chairs and things like that, like wheelchair bound or something. But on average, that's the weight loss is about 4 to 5 kilos, depending on how much effort we put in, and so on and so forth. If there is no weight loss, that's not the failure of the patient. Maybe they are one of those 5% of people who do not respond to treatment. And that is a reason why they should be under doctor's surveillance and observation. Maybe they need a different approach, different medication to help them with their weight loss.
Just to add up on this, so an important piece of information, sometimes patients ask, so if I reach my target weight, can I just stop the medication?
Again, it's a very important point that you're mentioning, Dr. Anfal. Thank you. I would say if we look at obesity as a chronic disease, and if we handle it that way, we will be able to kind of plan the future, in a better, more productive way. So if someone manages to lose weight to their target weight, and they are able to keep it off by lifestyle, like having healthy diet, regular regimented exercise. That's great. They may not need the medications. I personally recommend tapering the medications so that it's not a shock to the system to stop them altogether. But some people can't, and some people, despite that, they regain the weight. And in those cases, the treatment would be on the long term. Because the genetics, I go back to the same point, genetics are not changing, they are the same. And sometimes, no matter how much you do, the weight starts to increase. We know, like hypertension, people have high blood pressure, we give them treatment, blood pressure goes down to a normal level. If we stop it, the blood pressure goes up unless the person have modified their life. For example, if the weight is related to obesity and they lose weight, their hypertension may go away. Or if their weight is related to an endocrine problem and we correct that endocrine problem, the blood pressure will go away. Or if they consume lots of salts and we have low salt diet, the blood pressure goes away. But if there are those who have genetic hypertension with, we call it essential hypertension, even if they do all that, they will still have hypertension. If they stop their treatment, the blood pressure will go up. So there is no one size fits all, but all possibilities are there, and the patient need to understand this point. It's not a failure if the weight starts to come back again. It just means that we need to take the treatment on a long-term basis.
So follow-up with the doctors are very, very important.
Absolutely, to maintain the success. It's not easy to lose weight, and it puts lots of effort from patients, and for them to regain the weight, it can be disheartening.
True.
So it's better to avoid that kind of sad.
Thank you so much for the valuable information. So just before we come to the end of it, Dr. Nisrine, could you share with us any success stories that you faced with your patients in the clinic with regards to weight loss medications and injections?
Yes, sure. So what's impressive about those injections is that sometimes they do reverse the diabetes. And this is a concept that we did not see often before starting those injections. So when we have reversal of diabetes, I consider this a great success. But also these injections are approved, some of them, not all, for 12 years and above. And I remember one patient who was 15-year-old, and we tried everything with her, and she has genetic obesity and she has polycystic ovaries, and this was taking a toll on her mental health as well. Yeah. So after starting these weight loss injections, she responded very nicely and beautifully. And after that, the parameters were all better, but she did not care about that. I cared about that. She was much more confident and felt better, and now she's going to university in a better mental state and health state. And this is, of course, for me, a success story.
Amazing. What about you, Dr. Ali?
So two cases spring to mind. One resonates with Dr. Nisrine's case. I had a patient coming to me last year with a weight of 160 with a new diagnosis of diabetes, which was poorly, like very high sugars, high blood pressure, high cholesterol, like everything was kind of wrong. And we had a very long and hearty discussion about what's the best way moving forward. We started treatment, we started an objective weight reduction program. I saw him earlier this month and he was 101 kilos, so he lost 60 kilos. His blood pressure is normal, his cholesterol is still a little bit high, his sugar is normal, completely normal, and we are still kind of working on getting him into kind of his optimal weight for his kind of height and age. And to him, again, same point, it's not the figures as much as feeling better in yourself, feeling energetic, being able to achieve in life. The second one is another patient I've seen today, started with 129 kilos, and I saw him today with a complaint of dizziness. We struggled initially with his hypertension. We had to change his medications a few times, and he was on a very strong treatment. Today, after losing that weight, today he was 93 kilos.
Sure.
He's getting dizziness because the treatment became too strong for him. So we had to reduce his treatment down, and he feels a lot better in himself and more energetic. And this is what matters to patients, quality of life. At the end of the day, you don't care as much as a figure or something. It's more of a quality of life our patients achieve, and that's what we are there about.
Exactly. At the end of the day, that's what matters. Thank you. Thank you so much for being here today and for sharing all the valuable information. We hope this helps our viewers and listeners to benefit and seek care where they need it. See you in another episode of 𝗛𝗲City Podcast. Bye-bye.